If you've had a loved one or family member that's died from a suicide, the question for you is whether the suicide was preventable. There's two things you want to look at in these type of cases. What were the risk factors of suicide? And number two, how did your loved one present on the day of the suicide? Let's look at risk factors number one. Was there any history of prior suicide attempts? Prior suicide attempts is the number one risk factor for a suicide. What was the psychiatric diagnosis? If your loved one had a diagnosis of bipolar disorder or depression, that is one of the most likely psychiatric diagnoses to lead to suicide. The second factor that you want to look at is how did your loved one present on the day of their suicide? Did they present with signs that they were likely to hurt or kill themselves that day? If the medical records document that your loved one wanted to kill themselves, then they should have been admitted by the hospital, or the doctor should have admitted them to the hospital that day. Here's the critical thing. Many patients will deny the risk of suicide. So what the hospital or doctor needs to do is speak with family members, treating doctors, members of the police or surrounding community to find out, is this patient telling me the truth whether he wants to hurt or kill himself? And once you have that information, the decision has to be made. If there is a risk of suicide, and even if it's a small risk, the patient must be admitted for observation and care. If you have questions, you can call me on my toll-free number, 1-866-889-6882. You can also get my free ebook, The 7 Deadly Mistakes of Malpractice Victims, from the homepage of my website, protectingpatientrights.com.